Hello, my name is Melissa Devine.
And I'm Miller Killgore.
We did our evidence-based practice project on contrast baths used as a modality to treat carpal tunnel syndrome.
In the physical agent modalities theory and application for the occupational therapist textbook, contrast baths are defined as alternating cold and hot water immersion of the affected limb. Contrast baths are commonly used in the clinical setting to facilitate the decrease in edema, pain, and joint stiffness, as well as to increase blood flow.
The purpose of the study we looked at was to determine what the effect in using a contrast bath would be on patients with carpal tunnel syndrome. The null hypothesis researchers had was that the use of contrast bath would have no effect on hand volume in carpal tunnel syndrome patients. Researchers were looking to determine if contrast bath had a clinical significance to support it being utilized in a clinical setting.
First, we're going to talk about methodology. A randomized control trial was used to test the changes in hand volume in patients that were diagnosed with carpal tunnel syndrome. 58 subjects were gathered for this study from a privately owned hand clinic in New Jersey. Inclusion criteria for this study consisted of participants who were diagnosed with carpal tunnel syndrome, who had undergone a one-time carpal tunnel release surgery, participants who were over the age of 21 and were required to sign an informed consent, subjects that had recurrent hand injuries and revisions of previous carpal tunnel release surgeries, and subjects that had systemic or neurological conditions were excluded from this study. There were 36 females and 22 males. Of the 58 subjects that were chosen to participate, 8 subjects could not participate in the post-operative testing due to the amount of time that the evaluations and treatment sessions took, so they were removed from the study. The 50 participants that were left participated in the post-operative treatment, and 6 more patients were added to the final study. The final data was gathered from a total of 56 patients. The patients that were chosen for this study were randomly selected to participate in one of the 3 treatment groups of contrast baths with exercise, contrast baths without exercise, and exercise alone as a control group. This article represents Level 2 evidence. Although this study is a randomized control trial, it is a Level 2 evidence article because of the small number of participants. In order for this article to be a Level 1 evidence, the study should have 100 subjects or more, and this article only had a total of 58 participants.
To perform their intervention, Jensen, Schwartz, and Velman used a hand volumeter to measure the participants' hand volumes. The participants and the researching therapists were unaware of which participants were receiving which treatment. The first treatment session was done 3 to 5 days before the surgeries were performed. The second was done 10 to 14 days later, and the other treatment was given during that session, and the sutures were also removed. The different treatment groups received their respective treatments. The first group was the contrast bath while performing a composite fist exercise. The second group had contrast bath alone. The third group excluded the contrast bath and used exercise only during their treatment sessions. The exercise group was a control group. The participants in Group 1 and 2 underwent a very specific contrast bath protocol. There was a 1-to-1 ratio used, in which participants used a hot water bath and then a cold water bath for 1 minute each. This continued for 11 minutes. The participants ended with the hot cycle on the water bath, as they also began using the hot water bath. The water temperature was kept at 70 to 105 degrees Fahrenheit. The exercise-only group used flexion or extension exercises, which they held for 6 seconds during their 11-minute treatment sessions also.
Results and conclusions. The treatments in all 3 groups that were conducted pre- and post-surgery resulted in a slight increase in the average hand volume. The first treatment group, contrast baths with exercise, pre-surgery, had a change in hand volume of 4.5 milliliters, and post-surgery had a change in hand volume of 5.5 milliliters. For the second treatment group, contrast baths without exercise, pre-surgery had a change in hand volume of 5.8 milliliters, and post-surgery had a change in hand volume of 8.3 milliliters. And lastly, for the third treatment group, exercise alone, pre-surgery had a change in hand volume of 3.6 milliliters, and post-surgery had a change in hand volume of 3.7 milliliters. The increase in hand volume within each treatment group individually was recorded as statistically significant, but as a whole, the study was proven to be statistically insignificant. The study states that with an effect size of 10 milliliters change in hand volume, the study would be considered clinically significant. Although the data reflects that there were increases in hand volume in each treatment group, the increases in hand volume did not exceed 9 milliliters. Therefore, the study was not reflected to be clinically significant. Although contrast baths are a popular modality used in the therapy world today, this article found that the effectiveness of contrast baths to decrease hand volume after carpal tunnel release surgery was not clinically significant. Because this study was directed only towards carpal tunnel syndrome, the findings and results that were proclaimed do not encompass patients who could have had carpal tunnel syndrome along with other comorbidities or patients with other hand diagnoses such as a crush injury or fractures of the hand or forearm. It cannot be speculated that these specific results are true for contrast baths and other hand or forearm injuries. It was concluded that further research should be conducted in regards to contrast baths expanding to involve other hand and forearm injuries.
The results of this case can be applied to clinical practice as a modality for carpal tunnel syndrome very selectively. Researchers found that there was no real clinical significance of using a contrast bath in treatments, but they also did not find any evidence to show that there was a real negative effect with using the baths. From this, we can apply the use of contrast bath to practice by using clinical judgment on a case-by-case basis. If the patient with carpal tunnel syndrome is not showing results using other treatment routes, this could be used as a treatment. From the results of this study, clinicians would want to take into account that if using the bath alone, the participants in these groups showed the most increase in the volume. The results showed that if the contrast bath is used in this modality, that the clinician and patient will want to add the treatment into the bath, and they want to use exercise while doing the bath regimen. Since this study did not show clinical significance to being a positive addition or a negative addition, the treatment can be applied to practice if the clinician deems is an option for their patient and use their clinical judgment. When Miller and I were deciding how we could use this research in our practice, we discussed that the contrast bath in this study was only for carpal tunnel syndrome, which would require us as novice clinicians to do more research before using the treatment on other diagnoses. From the results in the study, we both want to utilize other modalities before using the contrast bath to help our patients with carpal tunnel syndrome. We also discussed that from the results, if the bath was what the modality of choice on the therapy order, so the doctor would have recommended it, then we would want to use it in the context of the contrast bath with the exercise combined group. We would also be able to use these results as evidence in supporting our use of other modalities first, since this research study did not actually prove an effect in reducing the patient's hand size, which is the goal of using the modality in therapy when dealing with these clients. However, while the research did not find it was significant, they also did not find that in this population, the bath would cause an increase of volume outside the 10 milliliter threshold. So this is a modality that we could use in the event results were not being seen with other treatment protocols, and along with what the client and we decided this treatment should be tried. So if we talked to our client and they saw the research that this could be used, but it might not exactly work as they anticipated, but nothing else is working, as a team, we could make the decision to potentially use this as a treatment plan. Overall, the research did not support us utilizing the contrast bath as a first choice modality, but it showed that it could be used cautiously and with collaboration in a clinical setting.